A doctor explains who's who in the hospital, the roles of medical students, residents, fellows, and attendings. Hey everyone, welcome to A Doctor Explains. If you have ever been in a hospital or watched a medical drama, you have heard terms like medical student, resident, fellow, and attending, sometimes also called staff position. But what do they actually mean? How do you recognize who is who, especially when everyone kind of dresses the same? And who's in charge? Should I refuse care from the resident? Today, I'm going to break it all down for you in simple terms. Let's start at the beginning. A medical student is someone in medical school, which generally lasts 3 to 4 years after at least 3 years of undergraduate studies. They're learning the science and art of medicine, and during the last 2 years or so of medical school, they spent time doing clinical rotations. Medical students don't make independent decisions about medical care. They're there to assist with care under supervision. You can think of them like apprentices who report what you tell them and what they find when they examine you to their supervising physicians. After graduating from medical school, doctors start residency, and this is where they practice medicine under supervision. Residents are indeed quote-unquote real doctors, but it's just that they're still in training. Residency can last anywhere from 2 to 7 years depending on the specialty and the country, generally speaking shorter for family medicine and longer for other specialties. Residents write orders, they can diagnose patients, they can do procedures, but everything is overseen by more experienced doctors. Residents are basically full-time paid trainees getting hands-on experience. Now, when I was in training, I sometimes encountered patients who refused to be seen by a resident or a medical student. But you really shouldn't do that. First of all, you most likely will wait longer because the staff physician or attending physician is less available. Second of all, when residents and medical students are involved in your care, they spend a lot more time with you and your case gets analyzed by multiple people. More eyes on your health, generally speaking, means better care. Then after residency, some doctors will do a fellowship even though at that point they can practice on their own. And that's because they want extra training in a special area. Like someone could already be a neurosurgeon, but they want to specialize in how to get tumors out of the base of the skull. So they become fellows. In addition, in countries like the US and Canada, you might also encounter fellows who are fully licensed physicians from another country. So they're completing a fellowship because they want to gain specialized experience in US or Canada that they can bring back to improve healthcare in their home countries. An attending physician, also called a staff physician, is a physician for whom all the training is complete. They supervise residents, fellows, medical students. They make the final calls on diagnosis and treatment. If you're a patient, the attending is the top of the chain, the one who's ultimately responsible for your care. So in summary, medical student equals learning in school, resident equals doctor in training, fellow equals doctor specializing further, and attending physician or staff physician equals fully trained and in charge. Another common question is, how do I tell people apart on my healthcare team? I really wish that we made this easier for patients. And when I was a medical student, at least back then, medical students were short white coats, residents and fellows were long white coats, and the staff physicians wore long white coats on top of formal clothing like suits. But nowadays, all bets are off. And you can't even judge by age because you have some students who are entering medicine after a PhD or a second career. My youthful-looking partner, who is a merge doc, sometimes gets mistaken as a med student, and his med student, if they look older, will get mistaken as the staff physician. So what you should do to tell who is by either looking at the badge that they're wearing or by how they introduce themselves to you. And if you forgot, you can also ask, hey, can you explain for me again what your role is on the healthcare team? If you found this video helpful, please give it a thumbs up and subscribe for more content like this. If you have any general questions about healthcare, drop them in the comments and I'll see how I can help.